Hello everybody, this is Margareta Harris in WHO Headquarters Geneva, welcoming you to our Global Press Conference on Question.
So thanks very much. Yes, we are aware of the new requirements in France, and so I think what you're seeing is an example of countries that are looking at the situation in their country. They're looking at what's happening in terms of transmission, in terms of increasing case numbers and where those are happening, and they're implementing measures again where and when needed. And I think that what we've outlined with the use of masks, which is part of a comprehensive package, it's one of the tools that are at our disposal that we can use in the control and prevention and control of COVID-19, and specifically in looking at breaking of chains of transmission, that these measures may need to be put in place again. So with the use of masks, the recommendation, is to ensure that you use masks when you can't do physical distancing, because I think one of the things I really want to highlight here, and what I'm becoming a little bit concerned about, is where I'm seeing the use of masks, we're seeing that people aren't really adhering to the physical distancing anymore. Even if you're wearing masks, you still need to try to do the physical distancing of at least 1 meter, and even further if you can. So it's not just masks alone. It's not just physical distancing alone. You've heard the DG say this many, many times. It's not just hand cleaning alone. Do it all. But again, I think we need to be supportive. We are supportive of governments in the use of the different interventions that need to be done. We are very hopeful that these are targeted, these are time-bound, and these are really specific to where they are needed.
Thank you, Dr. Van Kerkhoff.
Can I supplement there, Margaret? Because I think another point that Dr. Tedros made in his speech is that we also need to be cognizant of communicating to people changes in the process. There will be and there have been changes in national policy. And as countries regionalise their response down to provincial or state or county level, then you may find that there are different measures in place in different parts of the country. That doesn't represent a failure. That represents governments coming to grips with how different the epidemiology is from one area to the other and trying to match the measures to the local transmission, and therefore doing the least disruption to normal life that they possibly can. And that may mean that you have one measure in one area and 5 kilometres up the road, different measures in place. And that can appear confusing. And if governments change their policies too often and don't communicate them, then there can be confusion on the ground. So it's really important as governments shift their strategies and policies, and they do have to do that to get more precise in their measures, that they're also able to communicate them and communicate the reasons for the changes and the reasons for the evolution of the response, so people understand why something is happening, they understand the purpose of that, and then they also have the capacity and the time to put in place the necessary changes to local actions and local activities.
Thank you very much, Dr. Ryan and Dr. Van Kerkhoff. The next question comes from